So for all the cases that we do on a Thursday, we call it top the train wreck, right? Not just stop, but top it, meaning your mentality and attitude should be, no matter how complex these patients are and how devastated they come here from all over the world, you must fight for their best vision and artistically. Don't do barbaric surgery. Don't get in and reverse their surgeon's surgery just for the heck of it and then land in a worse problem. Think vision, think artistry, think the patient experience, and then think potential. So here's a wonderful patient. He had intact surgery in Boston, if you can see here. 2 rings put in here, but the rings are jammed on this side, if you can see here. Pretty much jammed, and they are causing about 5.8 6-diopter astigmatism. You can see right here, right? And with that astigmatism, vision is very distorted. He can't be corrected with glasses. He's tried contacts, uncomfortable with it, very disrupted life, and what does he do? Now, nobody's wrong. Everywhere he went in the country, they were told, go in for a transplant. As you know me, I want the least interventional surgery for the most visual impact, right? So when I look at something like this, I forget and I don't want to know who's the surgeon, which state or country they've had surgery, and I look at this eye and I go, where's my gold? Vision potential. So when I refracted this patient, I could actually refract this patient to an excellent vision endpoint. And at the same time, I want you to look at something else I looked at. So when you look at this with the Penacami XL wave, and you could use any technology, we have everything, eye trace, everything. All I want you to see here is, if you can see here, you can see the cornea with its both rings in place. And you can see the lens, which is cloudy here. You see that? So the other point of all my plastic surgeries is that you cannot leave any culprit unattended to. So if I would do anything on his eye like a LaZrPlastique on top of his intact, which you can, right? Then I would be leaving a culprit, his early cataract in the eye. And again, he'll have to come and spend money and do surgery. You don't want that. You want to be a designer in the right direction. You don't want to do zigzag. You want to be always straight ahead, plan for the patient. So seeing the rings in place, even though I don't like the way the rings were done by excellent surgeons, and landing at that high astigmatism, here's my 2 things I always teach you. Measurability and stability, right? The fact that I could measure him through that cornea, and the fact that his doctor, even though the intacts are not done in the way I would have, they had at least made him stable over the years. That makes me accurate to proceed for his lens-based surgery, which I call LaZrPlastique with my technique, the proprietary algorithm, and how I address the irregularity without touching the cornea. So think about it now. We are also removing his hazy, cloudy lens, exchanging it with the toric lens, which is my ability and what I teach all the time, how to use astigmatism to its advantage. Use astigmatism to beat astigmatism. So in a no stitch, no anesthesia besides numbing drop, no, patients don't even take sedation here. We went inside his eye, did his lens exchange surgery with a high toric Clarion lens implant, brought him straight to vision. And you can see here, as you can see, this is his pre-op, and you can see now the post-op of this patient, and he flew away. So you can still see the rings jammed here, but no matter how the rings are, at least they are stable for the cornea, and the cornea was also measurable. And that's a high toric lens implant on the steep axis. You can see again, no stitches, no anesthesia. Patient had a pleasant experience and is already seeing 20/25 without glasses or contacts. So that's what I mean by top the train wreck. No matter what complications patients come to you with, do not give up on them, and never do barbaric surgery, cutting this, hanging that. Don't do any of that. Focus on the vision, and you'll become a very artistic surgeon, and you'll always land on vision. And the patient will love the experience because you really want to fight for them. With that, Dr. Gulani.